everyone, and welcome to the first lab on bones. We're going to be dealing with 3 of these videos, and so this is a 3-week long lab section. So this we'll deal with today. We'll be doing skull and associated bones. We'll be doing that first video. So anyway, just want to remind you to succeed in life, you need 3 things: a wishbone, a backbone, and a funny bone. So let's try to laugh a little bit. Now, as we start off with bones, we're not going to really get into the bones just yet. We're going to get in and talk about some of the descriptions of bones. One of the things on the test that I will ask you on some of these is examples. Now, the sutural bones or worm bones, sadly, the skull I have doesn't have a sutural bone. And I don't have a picture that shows these in these notes. I do in my lecture notes, so we'll see these in the lecture. We'll actually talk about these again in the lecture, so I'll go more in detail in the lecture on this. I don't really worry about it in the lab as much. I just talk about that they exist. These are found between the sutures of the skull. Irregular bones, they have very complex shape. For example, these will be your vertebrae, your coxal bones, and your sphenoid. Your short bones are box-like. They have roughly equal dimensions. These would be example be your carpal bones or your tarsal bones. Those 2 types of bones. Flat bones are thin and flat. Parietal bones, sternums, ribs, and scapula. Long bones, they'll be elongated. They have a shaft with 2 ends that are wider. These would be an example will be your humerus, your femur, radius, and tibia. And then sesamoid bones, they're small, flat, shaped like sesame seeds. An example will be your patella. Okay. Now, one of the things I want to remind you guys, there's 2 types of osseous tissue that's out there. We didn't really talk about this too much when we did osseous tissue, but there's compact bone and spongy bone. What makes bone itself hard is there's a material in it called hydroxyapatite. That's the crystalline mineral matrix. That's actually the mineral matrix of bone. Remember, connective tissues have a matrix. And there's the osteon, sometimes called the Havartian canal system. It's the functional unit of compact bone. Remember, there's osteocytes trapped in the lacuna. There's canaliculi. There's a central canal, sometimes called Havartian canal. And there's concentric lamellae that we saw as well. We saw them. I already did the histology of bone in the histology section, so I just remind you of it, and I go on from there. We've already done it in the histology section. The only thing we didn't see is concentric lamella or lamellae. So one of the things on the multiple choice section of this test I might ask you is questions like, how many axial bones, how many appendicular bones are there? So there's 80 axial bones in the axial skeleton, there's 80 bones, and there's 126 bones in the appendicular skeleton. Together this makes 206 bones of the normal skeleton. Now the axial skeleton is this part in yellow right here. This includes the skull, the thoracic cage, that's like the ribs, sternum, all that, your vertebral column, your sacrum and coccyx. Then there's the bones that attach the axial skeleton. That's going to be the bones of the upper extremity and the bones that hold the upper extremity on, and the bones of the lower extremity and the bones that hold the lower extremity onto the axial skeleton. Okay, so that makes the appendicular skeleton, the appendages. Okay. Now, this is the axial skeleton, so you can see the skull, the ribs, the vertebrae, the sacrum, the coccyx, that kind of stuff. Thorax, sternum, and all that stuff, okay? Now, the skull is 22 bones. We're going to be talking about skull and associated bones. So we're going to talk about skull and associated bones. We have the 22 bones. We have the face, 14 bones there. We have 8 bones in the cranium and 7 associated bones, total bones that we have. Okay, skull and associated bones. Now, the skull itself, here's some diagrams to help you guys with the skull and all the parts of the skull. We're going to start with each bone, and what we're going to do is here's a list of the structures you need to be able to identify. Now, we're going to start by listing these things. So, the supraorbital margin. So, let's go and find supraorbital margin. So, supra means above. Orbital references the eye orbit, so eye socket. So, what we're going to do is we're going to find the eye socket. Sorry, my mandible came off. I'm going to go ahead and take that off. And we have our eye socket or eye orbit here. So what we're looking for is above the eye orbit, we have a margin. This is the supraorbital margin. And you can see this line right here. So I'm at my dining room table. So supraorbital margin. Okay? That's the first structure, supraorbital margin. Next structure, supraorbital notch. Now this model doesn't depict it very good. But right about here, we would see a notch. It is barely depicted on this model here, but not on that side. Supraorbital notch. There's barely a notch right there. I borrowed the best skull we have, one that's actually intact and things like that. Then we have the frontal squama. Frontal squama means flat. This is the smooth, flat part of your forehead. Okay? Frontal squama. And then we have the lacrimal fossa. Where to find the lacrimal fossa is to go to the eye orbit, go in it, go to the upper lateral, superior and lateral, and you will find the lacrimal fossa. That's where the lacrimal gland sits. Lacrimal fossa here, lacrimal fossa here as well. That's the lacrimal fossa. Okay. That gets our frontal bone. So this is the frontal bone right here. Frontal bone. Okay, this being the frontal bone. Okay. Next, what we're going to do, so there's diagrams, so you guys can help you find them when you go look for them yourself as well. Watching my video, what I recommend is you watch my video while you go get a skull from the library and check it out. For those of you guys that are students of mine, those who are watching it who are actually my students, you can check out the skulls and go through them. So here's the skull parts. Now, parietal bones. There's left and right parietals. Parietals, we have a left and right. Now I'm going to turn it around like this. We're going to look here. Here we have the parietals. We have a left parietal and a right parietal. These are the two parietal bones. Okay. Now there's no structures we have to know for parietal bones for this course. You may have to know some for other courses. If you're watching this video for other classes and we're missing things, this is for the course that I teach, and we have a very specific set of structures that we're required to cover. Okay. Now the occipital bone is a very busy bone, so there's a lot here. So we're going to start with the external and internal occipital crest. So I'm going to do those two structures, external and internal occipital crest. So to find the external occipital crest, what we want to do is take our skull, flip it over, look at the bottom. Okay. I'm going to take the top off to make that easier for me. Okay. Now, what you want to do is find the big hole, which we will come to this in a moment. I'm going to zoom in just a little bit. Okay. We want to find the big hole, and what we want to do is just below the big hole, we're going to find this line right here. This is the external occipital crest. Now, if there's an external, there must be an internal, because we don't use words in anatomy we don't need. So what we're going to do is we're going to flip this over and look at it inside. That's why I took the top of the skull off, and you're looking at it from the inside. Again, finding the big hole, we're going to find a crest right here. This is the internal occipital crest. Okay? All right. Next, we want to turn our attention to the occipital condyles. To find them, what we want to do is turn the skull back over, looking at the bottom where the big hole is. Find the big hole, and on both sides of the big hole, here and here, here and here, we have occipital condyles. These are for articulation with the first cervical vertebrae. Next, we're going to see the big hole, the foramen magnum. Now, the word foramen means hole. Magnum means large. This is a big hole. This is the foramen magnum. If we look at it through this way, we can see the foramen magnum there as well. Foramen magnum. Okay. Not magnum foramen. Foramen magnum. Kind of think of it like 357 magnum. 44 magnum. Okay. Magnum comes second. Foramen magnum. Okay. The hypoglossal canal. To find the hypoglossal canal, we want to find the occipital condyles. Look to the side and you will see a hole. Foramen means hole. And right there, there is a structure under that called the hypoglossal canal. Here and here. Hypoglossal canals. Okay? Now this is a 4K camera, but not running 4K through my computer. But still pretty good resolution. And then the jugular foramen. And it's between the occipital and temporal bones. So what we're going to do is find the jugular foramen. Now to find the jugular foramen, find your occipital condyles, come to the side of it, and they are here and here. Here and here. Okay, here and here. Okay. All right, so you can find the structures here. And here's diagrams to have all the structures to help you. Diagrams and models and photographs of real bones to help you locate everything. Okay. Now, let's look at the temporal bone. Also quite busy. We're going to start with each structure. This is the list of structures you're required to know. So let's start with our squamous portion. So what we're going to do is squamous portion of the temporal bone. So by the way, this was the occipital bone right here at the base of the skull, occiput. Now we're going to find the temporal bone. The temporal bone is seen right here. Here's our temporal bone. You can see it on the side. We can look at it a little bit down here at the bottom. Everything in that inside that yellow line. We can take the skull off and look at it in here as well. Okay. Okay. So let's start with the squamous portion. Squamous means flat. So the flat part, that's this portion right here. This is the squamous portion right here. Okay? This smooth, flat area. Okay? Okay. Now, zygomatic process. Right here is the zygomatic bone. This process goes towards the zygomatic bone. So this is the zygomatic process of the temporal bone. Mastoid process. The large mastoid process is located right here. This is your mastoid process. A lot of times to see it better, I'll put my finger behind it so you guys can see it better. Mastoid process. The styloid process. The styloid process is located right here. Here we have a styloid process right here. We also can see it on the other side right here. Okay. Styloid, stylus, stick. Okay. Stylomastoid foramen. To find it, what we want to do is turn, I'm going to take the top of the skull off because it makes it easier to handle. I'm going to turn this like this, and what we're going to do, we're going to find the styloid, we're going to find the mastoid, and we're going to look right in here, and we're going to find the stylomastoid foramen right here. Stylomastoid foramen, right there. Stylomastoid foramen, okay? Then we're going to see the carotid canal. To find the carotid canal, I'm going to turn the skull around like this, and what I'm going to do is go back and find the jugular foramen, okay? Then what we're going to do is in front of the jugular foramen, right here is the carotid canal. Now in this model, it is not burrowed through, so it should be all the way through the skull, but this is carotid canal here. This is carotid canal right here as well, okay? Carotid canal. Okay. Now what we also want to do is the mandibular fossa. Mandibular fossa is right here where these little rubber cups are. That is where your mandible will articulate, is the mandibular fossa. So where the mandible articulates. Okay. The external acoustic meatus and the internal acoustic meatus. The external acoustic meatus, right here is our mandibular fossa. Right here is our external acoustic meatus here on the side. Just above the styloid process, you'll find the external acoustic meatus, a nice landmark. To find the internal acoustic meatus, we want to look in the skull. We're actually looking at one right here. Right there. And we also can see one right here. Here. And here. Okay. Now, the next we're going to see is the petrous portion. It means the rocky portion. This is the squamous portion, the flat portion. Inside we have the rocky portion, the petrous. It means rocky portion. Here and here. It looks like rocky mountains. Here, 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 here. Okay, it means rocky portion. Okay. Now, there are some diagrams to help you guys in my notes. So you'll need my notes to, and you can pause it and look. Okay, now let's turn our attention to the sphenoid. The sphenoid, where we're going to mostly see the sphenoid, is in here. We'll mostly see it in here like this. We'll see it right here. This is the sphenoid bone right here. It looks kind of like a bat. A little bit of the sphenoid can be seen right here. And you can see the sphenoid back here in the back. Okay. Now, mostly we're going to look at sphenoid internally. Most of the structures in the sphenoid we see internally. We're going to start with the sella turcica. Sella turcica means Turkish saddle. If you ever look at, if you do a search for a Turkish saddle, you will see a horse saddle that was used by the Turkish people, Middle Eastern, and their saddle looks a little bit like this. This is the sella turcica. If we look at it from a little bit on the side, you can see it kind of looks like a horse's saddle. This is the sella turcica. Right here, okay, sella turcica. Now the sella turcica, Turkish saddle, the lesser and greater wings. There are lesser wings right here, wings of the bat, lesser wings up here, and there's greater wings, the floor on the bottom. Now, also what we'll begin to see is the pterygoid processes. P-T-E-R-Y. Pterygoid. Pterygoid processes. To see the pterygoid processes, we want to take our skull and rotate it around, looking at the bottom, find the teeth, come to it, and here's the pterygoid processes. Here and here. There's actually medial and lateral ones, but we just have to know the pterygoid processes. Here and here. Here and here. Okay. The superior and inferior orbital fissure, the superior orbital fissure, and the inferior orbital fissure. To find those, orbital references the eye orbit or eye socket. So look in the eye socket. Let's look directly in there. Let's look at the top right here and find the superior orbital fissure here and the inferior orbital fissure here. Superior orbital fissure here, inferior orbital fissure there. The optic canal or optic foramen. To find it, look inside the eye socket, and right there we have it. Right there. It comes out right here. Okay, it comes out right there at the sella turcica. Here and here. Alright. And here's some diagrams. Now we're going to go to ethmoid. Ethmoid, we have the crista galli. Crista meaning crest, and galli meaning rooster. So this is the rooster crest. The cribriform plate, the olfactory foramina, the perpendicular plate, and the middle nasal concha. Or concha or conchi. Some say concha. Okay, middle nasal conchi. Okay, so let's do our crista galli first. Okay, crista galli. So I'm going to turn it around. Most of the ethmoid structures will be seen right here. Most of it, you're going to find the ethmoid right here. Now, you can also see the ethmoid by looking here. Here. Looking part of it in the nose as well. Okay. Now, that's the cribriform plate, or crista galli. Let's look at that first. Crista galli. Crest of the rooster is right here. This is your rooster's crest. I'm turning it to the side a little bit. Let me see if that lighting helps right here. I'm just using the natural lighting in my house right now, but it's starting to get a little bit darker. So, all right. So crista galli right here. It means crest of the rooster. On both sides of that, there will be the cribriform plates on both sides. Now, as well, you're going to see there are olfactory foramina. Now, to see these, we're going to zoom in quite a lot. And if you look at it, there's these bumps, little stipples. Those are the olfactory foramina. Some people have actually gotten some ink in some of these. Those are the olfactory foramina, those little tiny little bumps all over it. Looks like little holes. That lets the olfactory nerves go into the top of the nasal cavity. Okay. Now, the perpendicular plate, to find that, we need to go turn the skull, look inside the nose hole, and right here we have the perpendicular plate of the ethmoid. It stops right about here, right about there. So it's this part right here. About there it stops. The middle nasal concha. To find it, we look back in the nose hole, and we call these turbinates or conchae. The middle one is here. The superior is not visible on this model. There is a middle one and an inferior one. So that is the middle nasal concha right there. That is the middle nasal concha. Okay. All right. And there's some diagrams and models to help you, some real skull pictures. All right. Now that we've done all the cranial bones, let's talk sutures. These are where the skull is held together, basically where it is stitched together, okay? It's called the sutures. There we go, put the skull together. The coronal suture. When Jack fell down and broke his crown, he broke his coronal suture. This is the coronal suture right here. Coming here is the coronal suture, okay? Now, next we have our sagittal suture. Sagittal separates left from right. This is the sagittal suture. Next is the lambdoid suture. It looks like the Greek letter lambda, which is an upside down Y. To see this, we want to go to the base of the skull, where the occipital is separated by the parietals, and that is your lambdoid suture. Okay? And lastly, we have our squamous suture. To find that, we remember that there's a squamous portion on our temporal bone. Right here is the temporal bone. It has a squamous portion. Here is the squamous suture. Okay? All right, so that gets the cranial bones. So the sutures, you can see those all labeled there. Okay? So that gets your sutures. Now, facial is a little bit more complicated. There's a little bit more to it here. We're going to take a look. There's 14 bones in the face. We're going to start with our zygomatic bone. Zygomatic, to see that, we're going to look for the cheeks, the zygomatic bone. Now, we'll talk more about zygomatic in a minute, but there's the zygomatic bone. Here is zygomatic. Here, and also over here. Now, also we have the maxilla. The maxilla, which there are two of them, they are here on the upper part. This is the maxilla. Maxilla goes up here to the face, down here, here, maxilla. Maxilla is also seen stopping right there in the roof of the mouth. And also seen right here. Here as well. Here and here. So that's your maxilla. That's where your maxillary bone is. Now, there's an infraorbital foramen. This means it's below the eye orbit. Infraorbital. Below the eye orbit. A hole below the eye orbit. Right here, there's a hole below the eye orbit. There and there. Alright. Now, what we also have is an alveolar process or margin. That's where the teeth lock in. So easy to find that is find your teeth. The alveolar processes or margin is where the teeth lock in. So find the teeth and you'll find the alveolar margin or alveolar processes. Okay. Now, what we're next going to see, guys, is the palatine process. To find it, what we want to do is turn the skull upside down. I'm going to take the top of the skull off because it just makes it easier to set the skull down. And what we want to do is go right here to the roof of the mouth, and this is the palatine process of the maxillary bone, right here. Okay. Now, next what we're going to see is our palatine bone itself. The palatine bone is right here. You can see the palatine bone here. Now, really, we should be able to see a little bit of the palatine bone. If we look in the eye socket, there should be a little bit of palatine bone, but this model does not really depict it. But you would see a little bit of the palatine bone in the back of the eye socket. It is an eye orbital bone. It is one of the bones that helps form part of the eye orbit. The lacrimal bone, in its nasolacrimal canal, the lacrimal bone is found in the eye socket right here. Here it is. Here and here. On it, there is a hole that should be here. This model is not depicting it very well, but it's right here. Should be one right here. It's just not very well depicted. It's just not really showing it very well, but it should be right there. That's the thing about, I can't take every, it takes 3 skulls to show every structure, but I can show you where it would be. Now, nasal bones. Nasolacrimal canal, the nasal bones form the bridge of the nose. They are right here. This is the nasal bone. Here and here. Okay. Now, there's an inferior nasal concha, concha plural, and it's right here. This is the inferior one. Here and here. Okay. There's a vomer. To see the vomer, one way we can look at the vomer is to look at the nose aperture, nasal aperture, and we're right here at the bottom of the perpendicular plate. There's a perpendicular plate of the ethmoid and this nasal septum. It forms the inferior part of the nasal septum. It's called the vomer. Another way to see the vomer is to rotate the skull like this. Come to the back right here. We have the palatine bone. Right here is the vomer. Number 11 is the vomer. That's your vomer. Okay. It forms the inferior part of your nasal septum. So it's right here on the tip, the vomer. And it's located right here. And the mandible. Now the mandible, right here it is. Now we'll come back and look at this skull a little bit more, but this is the mandible, right here, okay? Now what we want to take a look at next is our zygomatic bone. The zygomatic bone, we're going to look, there's a temporal process on the zygomatic bone. So here we have the zygomatic bone on the side, our cheek right here, zygomatic bone, here. Now, to go towards the temporal bone here and go towards the zygomatic process of the temporal bone here, we have this bone, this part of this bone right here. This is actually called the temporal process of the zygomatic bone right here. Okay. Now, the mandible has a lot going on. We'll start with each structure. Here's a list of what we need to know. So let's start with the body. Sorry if you can hear anything in the background. My across the street neighbor's son started out their car, but I don't mind. So what we started with, I already forgot what it was, the body. The body is this area right here. This makes up the side of the jaw, the body. Now the angle is our neck structure. Right here is our angle. Right here is the angle. This area right here. Okay? Then we have the ramus. A ramus is an extension of a bone that forms an angle with that bone. Look how this is called an extension. This is the ramus. The ramus is an extension of a bone that causes an angle with that bone. We have the coronoid and condylar process. Coronoid process is going to be the one found here, is the coronoid process. This is a condyle, so this is the condyloid or condylar process. Condylar process here, coronoid process here. There's a mandibular notch. Located between the two processes we just saw, there's a notch right here. This is the mandibular notch. Located between the coronoid process and the condylar process, there is a notch. There is a alveolar process or margin. Alveolar process or margin, to find that, you look where the teeth are locked in. The ridge where the teeth lock into the jaw, that is your alveolar margin or processes. Mental foramen. Mental means chin. So we go to the chin. And right here and right here we have mental foramen. Then we have the mandibular foramen. To find those, what we need to do is go to the back of the mandible, rotate to the back, look right here, and we will find them here and here. Those holes. Okay. All right. So that's the main one. Now the eye orbit bones, for the orbit, we're going to have the frontal, the maxilla, the zygomatic, the lacrimal, the ethmoid, sphenoid, and palatine bones. This will be on my test. Just going to go ahead and say, bones of the eye orbit, they'll definitely be on there. Which of these maybe is or is on an eye orbit bone. So please know the bones of the eye orbit. They'll be on the multiple choice section of the test. I always like to ask it, just let you know. I always tell my students, this is on a test. Okay, I always ask something about orbital bones. Okay. Calvarium. What is the calvarium? That is basically the top of the skull. This is your calvarium. We call this the calvarium. Okay. Paranasal sinuses. I don't have a model for that. Paranasal sinuses. We have our frontal sinuses here in the front, near the frontal bone, into the frontal bone. We have maxillary sinuses right here, near the below the eyes. We have sphenoidal sinuses near the bridge of the nose, and we have ethmoidal air cells there at the bridge of the nose as well. So the sinuses, these are the ones when you have sinus infections, they can become infected and they can become occluded and things like that. So these are your paranasal sinuses. They are alongside this, your nasal sinuses. So this is your nasal sinuses. When we say your sinus cavity, we're talking about this space inside of here. These are alongside of that, called paranasal sinuses. Okay? Now let's talk fetal skull. And we'll talk fontanelles, the soft spots of the fetal skull. Okay? The fontanelles. There's an anterior fontanelle. And on the fetal skull model, right here we have it. This is your anterior fontanelle. Right here, the large soft spot on top of their head is the anterior fontanelle on the fetal skull. Then there's the posterior or occipital fontanelle. To find that, we want to go back here, and it's right here. Okay, the posterior or occipital fontanelle. Next, we want to see the sphenoidal fontanelle. Sphenoidal fontanelle is found right here, near where the sphenoid bone would be. It'd be right here. And next, we have a mastoid fontanelle. Right here is where the mastoid process would be, and this is a mastoid fontanelle right here, near where the mastoid process would be. Is the mastoid fontanelle. So there's an anterior fontanelle, a posterior fontanelle, a sphenoidal fontanelle, and a mastoidal fontanelle. And there's a diagram next to help you find those. Okay, one other bone we want to talk about is the hyoid, and this is associated with skulls called the hyoid. We're going to see it has a body and the greater and lesser horns called the cornu. So here we have a hyoid, and I'm going to zoom in on it. Sorry, I have dogs. You can see my dog fur on my... Okay. So this is a hyoid. There are greater horns found here, greater horns. And there are lesser horns found here, lesser horns. And the body is this part right here. Right here. Body, greater horns, lesser horns. Okay. Now this is actually not attached directly. It's soft tissue that holds it on. Muscles and connective tissues hold it on. Lastly, we're going to see the auditory ossicles, the malleus, the incus, and the stapes. Now I have the real thing. I'm going to put it side by side here with the hyoid so you can see how small it is. So this is a hyoid. This is the real malleus, incus, and stapes. These are the real things. They are found inside of a model that I have. It's a puck. The malleus, incus, and stapes. Alright, so this concludes the first section we're going to do. And that's where we're going to end. We're going to do skull and associated bones. So we're going to stop here and pick up a vertebral column and do part of the upper extremity in the next video. Alright, I'll see you guys in the next one.